Thank you for joining Dr. Ambekar.
Thank you. Pleasure is mine.
Yes. You work with the All India Institute for Medical Sciences.
Yes.
At the National Drug Dependence Center.
National Drug Dependence Treatment Center.
Treatment Center. Could you please tell us what that center does and what your profile is with the center?
Yes. So basically we are called National Drug Dependence Treatment Center. We are a part of All India Institute of Medical Sciences, associated and in fact a part of the Department of Psychiatry of All India Institute of Medical Sciences, New Delhi. The Ministry of Health and Family Welfare of Government of India had established a few institutes of excellence in terms of treatment of drug dependence.
Right.
So our task is not only to provide treatment and care to people affected by drug use disorders, but we also help in terms of conducting research, conducting training and education of other health professionals and other health providers, and sort of help, mentor and guide other institutes across the country to enhance their treatment facilities.
Okay.
And finally, we also sort of assist or advise the government on policy matters.
Okay.
So that's the kind of stuff we have been doing.
Okay. So is the problem of drug consumption or dependence that big that it warrants a different center of excellence?
No, I mean, it's so big that not just one or two centers of excellence, but we need many more such centers.
Okay.
Many years after independence, so many years, so many decades in fact, we did not have very credible data in this country on how many people are using substances, addictive drugs, and how many people are affected by drug addiction. So actually it's in last 3-4 years only when this whole project was started, and it culminated in the report titled Magnitude of Substance Use in India. This report was released 2019 by the Ministry of Social Justice and Empowerment. That task came to us, National Drug Dependence Treatment Center, AIIMS. We coordinated with other organizations and agencies throughout the country. And for the first time in the history of country, we conducted a truly national survey. Which means now we have figures not just for India as the national level, but also for individual states and UTs. So we now have figures for how many people consume ganja in Kerala, how many people consume heroin in Bihar, or so on. So, but the findings in many ways are really eye-opener.
So was, like you just said, the findings were an eye-opener. Was it something that shocked or surprised a lot of people about the scale of drug consumption or dependence?
Yes. So what happened was that the findings, in terms of some substances, it weren't so surprising. They just confirmed what we already knew. But in terms of some data points, they were really standing out. For instance, I'll tell you about alcohol. What we found was that about 15% of Indians, that means around 15-16 crore people in the country, they are current users of alcohol.
And by current users, you mean?
By current users, the definition which we used is the international definition. Consumption even once within past 12 months. So if you have consumed even once within past 12 months, you will be counted as a current user of that substance. So for alcohol, that figure was around 15%, which though on the surface of it may appear as a very small kind of figure. But then we are talking of the general population from 10 to 75-year-old. So, and both genders. So across men, women, children, elderly people, about 15% of Indians, they are current users of alcohol. But more importantly, about 5.2% of Indians are affected by alcohol use disorders. Which means 1 in every 3 persons who consumes alcohol is consuming it in a pattern that he needs help. He or she needs help for alcohol use.
About 5 to 6 crore people in the country.
About 5 to 6 crore people in the country.
It is a huge problem.
It is a huge problem. And secondly, this is very different from the global scenario. Globally, the world average of people consuming alcohol is about 50%. Considering many other countries where it's fairly common. But the proportion of people consuming alcohol in a problematic pattern, alcohol use disorders, its global average is also around 5%. So which means overall in the world, 1 out of every 10 person who consumes alcohol has a problem with alcohol. In India, it's 1 out of every 3.
Which is very
something which we also see if you see carefully around us in the society. either people don't drink,
Right.
or those who drink, they may not drink in moderation every day. But whenever they decide to drink,
They drink a lot.
they drink a lot. They drink
Oh.
excessively.
Okay.
You will often, in fact, hear people complaining when they are in that drinking session.
Right.
यार क्या बात है चढ़ नहीं रही. You know?
Yeah.
So the idea is to get drunk.
To get drunk.
You drink to
Okay.
get drunk, and that causes the public health implications of this
Yes.
are far higher.
Yeah. Yeah.
So for if, simply put, one person consuming one drink every day for 10 days
Yeah.
is a different thing.
Right.
That the same person consuming alcohol only once every 10 days, but 10 drinks on that one
Exactly.
occasion. The health implications are
Yeah.
different.
And what could the health implications be of such dependence?
Right. So what happens with alcohol is that there are two kinds of adverse consequences.
Right.
Some are related to the amount that you gulp down within a short span of time. So if you
In the case of binge drinking.
in something like binge
Okay.
drinking, where people in a short span of time they drink excessively.
Right.
So that time you have acute intoxication, you have gastritis and other kind of physical
Right.
effects, and most importantly in that phase of intoxication,
Right.
then you can meet with accidents, you
Yeah.
can harm yourself, or
Right.
you can engage in some silly behavior
Yeah.
and harm yourself or others.
Others. Right.
And then there are some consequences of alcohol which are dependent upon the absolute amount of alcohol that you have consumed over a long period of time.
Okay.
So if you are excessive alcohol user for a
Right.
very long period of time,
Right.
there certainly are going to be health consequences. In fact, no other substance is as harmful to the human body
As alcohol.
as alcohol.
And have there been any reasons identified for why that problem exists in India, where the dependence or the problematic drinking is so high, about 1 in 3, but it is not in other countries? Is it a cultural thing, or
I suppose a wide variety of factors are responsible for this. Some of the reasons, as you say, are cultural in nature, historical or cultural in nature.
Right.
For a very long time, if you see some of the historical kind of documents also, you will find that in the Western type of society, the European or from those kind of societies, alcohol was part of their ahar. So for them, alcohol was something to be consumed on a regular basis, perhaps, but in moderation. For Indians, alcohol has been historically a type of their vihar. Krida.
Right.
So that means alcohol is something you don't need to consume every day, every occasion.
Right.
You consume it occasionally, but then you do it for the purpose of what we call today as partying, merrymaking, enjoying,
Right.
having fun.
Right.
And hence perhaps that somehow as a collective
That association of alcohol with a certain type of state of mind.
Certain state of mind, and then to reach that type of state of mind where you need to feel sufficiently disinhibited
Right.
to be able to enjoy.
Right.
That perhaps could amount for this excessive consumption. Partly, then these are some of the historical, cultural, psychological issues that I talked about. Partly, some of the perhaps our policies are also responsible for it.
Oh, how so?
How so? Because the recommendations from a public health angle about pricing for alcohol products is such that it should usually be more expensive to consume high alcohol concentration beverages as compared to low alcohol concentration beverages. So the idea is that in terms of pure amount of alcohol that you ingest, beer should never be more expensive than whiskey.
Oh,
So
by volume.
By volume.
Right.
By volume of alcohol.
By volume, because
absolute
whiskey is
alcohol.
about 42%.
About 40-42%, while
And
beers are about
5%.
4 to 8%, depending on premium or strong. So, but in India, the taxation structures are such that beers are rather expensive. So it's much more cost effective for people to drink the spirits.
Right.
And then those spirits, whenever they are consumed, then there is always the risk of excessive consumption and acute intoxication and so on.
Right.
This is something we also found in our data when we conducted looked at the pattern of drinking at the national level. The maximum consumption is that of either the spirits, what we call as Indian-made foreign liquor.
Right.
Largely whiskey.
Right.
And then or the desi sharab.
Right.
which is also a high alcohol
High
concentration drink.
Yeah.
As compared to it, the low alcohol concentration beverages like beers, there people consuming them or preferring them is far less. And partly, as I said, the excise and taxation structure. They are
So is
possibly
it
responsible
so
for
the
this.
excise and taxation is same across?
Not same. It's in fact beer turns out to be much more expensive.
Oh,
for
so
people who
there's-
consume alcohol, they
Right.
will often tell you
Yeah.
that a
You have to-
bottle of beer
Right.
turns out to be much more expensive
Right.
than the same amount of intoxication that
Right,
you
right.
want from whiskey.
Because in most countries beer is quite cheap.
Yes, at least in the developed Western
Right.
countries, where the
Compared to
pattern
whiskey
which
or
we
hard
see,
liquor.
yes,
Right.
compared to the spirits.
Right.
So, so that's how I mean the problem needs to be looked at from a public health angle
Right.
rather than purely economic
Right.
or
Moral
the purely
point.
moral.
Yeah. I think morality sort of overlaps our overlaps with public health or policy thinking when we're thinking about these things, that what to prioritize. I think our policy making has had a very strong moral angle compared to policy or evidence-based public health angles.
Yeah, I mean, what is in the benefit of large number of people is a moral issue, no doubt
Right.
about that, है ना?
Absolutely.
So that itself is a moral issue that you should have those policies which benefit a larger set of population.
Exactly.
And causes overall more good to people rather than harm.
Right.
Everything will have some good effects,
Yeah.
some negative effects.
Yeah.
Overall, on the balance,
Right.
the policy should be such that they promote public health. and
Correct.
harms.
Right.
About the morality issue which you said, that for particularly for alcohol, to some extent for other drugs also, but particularly for alcohol, Indians tend to display a dichotomy, a vice versus virtue binary,
Right.
right? So
Good and bad.
good and bad type of binary. If you talk to Indians, they'll often introduce you about someone, telling about them that he's a very nice person, बहुत अच्छे इंसान है, चाय कॉफी भी नहीं पीते. You know?
Oh.
So which means it becomes a parameter
Yeah.
of your moral standards,
Exactly.
moral and spiritual standards.
Yeah.
No doubt about that. People who denounce pleasures, people who shun away the usual pleasures of life, either on a permanent basis or even occasionally, like keeping fast, observing fast,
Right.
or so on. That is given a kind of higher moral pedestal.
Right.
That goes without saying.
Right.
But that shouldn't mean that indulging in pleasure at the same time is seen with a moralistic
Right.
perspective. So that's why because of this binary of vice versus virtue,
Yeah.
we never have, or in the modern times we sometimes display a kind of intolerant attitude
Correct.
to use of these
Yeah.
substances.
And I think
While historically,
Yeah.
India never had this culture. India has
Okay.
always accepted
Okay.
that on some occasions, some people will consume one or the other psychoactive substances.
Right.
It's not something which is ideal. It's not something which everyone should start doing.
Yeah.
Right? Even at our homes,
Yeah.
we enjoy drinking tea and coffee.
Right.
But do we allow our small children to drink tea and coffee?
No,
We tell
not
them.
really. Yeah.
अभी नहीं बड़े हो जाओ अभी दूध
Exactly.
पियो. Right?
Yeah.
So that kind of social control, social regulations we had. If you talk to many of the traditional tribal communities of
Right.
India, either in the central India or in the northeast, they have cultural pattern of consumption of alcohol, different varieties of alcohol which they produce through
Locally.
local
Yeah.
stuff, rice beer or,
Exactly.
or palm or
Yeah.
whatever. But then even in those cultures, being drunk throughout the day, not working, not going to the fields is frowned upon.
Yes.
They don't accept it.
Yes.
So the idea is that when it's time to work, you are expected to work and look
Right.
after your work, your family, your
Right.
home, etc.
Right.
When it's times to have a party or to enjoy or whenever you have that kind of opportunity available,
Right.
that's the time to indulge in these kinds of behaviors.
Right. Interesting. You should mention that the cultural angle and historically what Indian society has been quite open about consumption of substances, and not just drugs, like other substances also. Like in our texts or sometimes even scriptures, it's mentioned the consumption of different substances. Like I think cannabis consumption has been mentioned, and but now we find ourselves in a place where Firstly, I mean, I'm not sure what the scale of consumption of something like cannabis is, but it is not discussed much. People take a very let's not talk about it approach to other drugs, harder drugs like non-alcoholic substances. So, just going back to your report that came out last year, do you think the consumption of other substances is also at a large scale?
Yes, it's about cannabis and other drugs. It's a very funny story in India.
Okay.
In India, as you know, we are possibly the pioneers of cannabis in the world. Right?
Okay.
So it's Indians and Chinese civilizations.
Okay.
For thousands of years, they knew that there is this plant called cannabis.
Right.
There are different ways it can be consumed.
Right.
Both these civilizations from the ancient times knew that this plant has certain type of medicinal properties as well.
Okay.
So, in fact, in the traditional systems of medicine in both India as well as in China, cannabis is used for preparation of various kinds of medicine. Something which the Western world has only recently started
Discovered.
learning.
Yes.
So, practically, we introduced cannabis to the world. It's the Indian plantation workers who took cannabis from India to the far off African kind of countries when they went in the colonial times.
Right.
And now ganja is a word in Jamaican language.
In Jamaican language, yes.
So that's how cannabis has spread.
Right.
But what happened was during British times, British people saw that a large number of Indians are consuming this cannabis thing in one or the other form. Either they are orally consuming bhang, which means either they are drinking or eating some stuff made out of bhang, or they are smoking, what is known as ganja or charas.
Right.
This got them worried. This got them worried for two reasons. One is that a distrust of the traditional native colonized people, brown colored people and their customs. कि पता नहीं ये जंगली टाइप के लोग क्या कर रहे होंगे, क्या नशा ले रहे होंगे, that kind of thing.
Because they were not aware of it.
They were not, or possibly not aware to that extent.
Right.
And secondly, there were also issues of health, whether it can cause damage to their health or not. And thirdly, cunningly, the issue also was if these people continue consuming and enjoying their bhang, then who would drink our gin and our whiskey, our Scotch whiskey, right? Which they were bringing from their country.
From
right?
Europe, yes.
Till date, we call it IMFL, Indian Made Foreign Liquor,
yes.
because of that influence.
Right.
So at that point in time, in around 1890s, late 1890s, the then British government instituted a large-scale inquiry into the effects of cannabis use on the Indian population.
Okay.
They called it the Royal Commission, Royal Hemp Commission.
Okay.
That Royal Hemp Commission possibly is, even by today's standards, one of the largest research studies of its kind.
Okay.
So that commission literally...
And this was about 100 years ago?
1895.
1895. Okay.
So that commission actually interviewed thousands of people. These included people in the community leaders, the religious leaders, people growing and consuming cannabis in different forms.
Okay.
The doctors of the both modern variety as well as the Indian vets and AIIMS also.
Right.
And they actually concluded that yes, a large number of people do consume cannabis, but surprisingly, there are no large-scale population size adverse effects of use of this particular product.
Right.
Some people do display some problems, some mental kind of problems, but it's difficult to comment whether these mental problems are a cause or an effect of their cannabis use.
Okay.
And this were their findings and recommendation to the British government then.
Right.
So,
but basically they were saying,
to some extent, the project of modernization of India, which British people were sort of indulging in, they succeeded in a large extent to sort of help change the way of thinking of Indians, of looking at use of cannabis, bhang, charas, ganja as something native, something backward, something more traditional, while alcohol came to be associated with being more modern,
something
more sahab.
Right.
Have you seen the movie Dawn?
Yeah.
Amitabh Bachchan?
Yes.
look at the remember that movie. There are two Amitabh Bachchans.
Yeah.
Right? But it's the modern, suave
The
boy.
Mumbai one.
He drinks whiskey.
He drinks whiskey.
It's the chora Ganga Kinare wala who
consumes
enjoys his bhang.
Yes,
Right? Bhang Range Jamal Chakachak.
I was listening to this song actually, Rajasthani song. It's called Kadi Auni, in which the woman is a folk singer describing that different level of people actually smoke different kind of, like, consume different kind of substances. So at the top there is somebody consuming whiskey, but at the ground there is somebody consuming ganja.
Right. So that's what something which possibly has been internalized by Indians. So that's how the whole attitude started shifting about use of cannabis.
Right.
But now the tables are turning. Now the Western world is realizing that, my God, alcohol is such a toxic and harmful substance.
Right.
And now many developed countries have started sort of legalizing or decriminalizing use of cannabis in various forms. So as of now, as things stand today in India, about 2.3 crore people, just about 3 crore people use cannabis in one or the other
3
form.
crore?
Yes.
That's a large number.
Yes, that's a large number. But that's the kind of number we are talking about.
Is it like spread in certain types of societies geographically, or is it spread out?
It's again, in this survey we looked at consumption pattern of both cannabis in the form of bhang or cannabis in the form of charas ganja also.
Right.
So what we found was that in the states where bhang use is not a traditionally socially accepted kind of phenomena. For instance, in most of the what we call as North India or Hindi heartland, we recognize bhang to be a relatively harmless kind of substance. In many states, it in fact has a legal status. There are bhang shops where people can procure and consume bhang. So in those states, the situation is slightly different. But in the northeastern states, for instance, the consumption of charas and ganja is far higher than bhang.
Okay.
So in the states like MP, UP, Rajasthan, where bhang is traditionally present, it's the bhang use which is higher than ganja or charas. So that's how. But overall in the country, more people are consuming bhang than charas ganja.
Okay.
But then more people are suffering from addiction to charas ganja as compared to bhang. Because bhang is a relatively milder kind of product.
Right.
Charas ganja is slightly more potent variety.
Yeah.
And hence the problem use of cannabis, what we call as cannabis use disorders, they are much higher for charas and ganja.
And what are these disorders like, cannabis use disorders?
Like for all other psychoactive substances, the category of disorders basically means two kind of diseases we are talking about here. One is the harmful pattern of use, where you use the drug or substance in a manner that it causes you some kind of harm, physical or mental health harm. You may not have developed the total addiction to it, but still the pattern of use is such that it is causing you harm. That is a kind of illness, that is a kind of disorder which requires help and treatment. The next stage is the stage of dependence. Dependence basically simply means, as the name suggests, that it's very difficult for you to lead a healthy or kind of appropriate life without using that substance. Use of that substance takes the number one priority over other things in your life. So somehow the main agenda of every day is to consume that substance and experience that effects. Without that, you will start experiencing the withdrawal symptoms. The sickness. And which makes it's very difficult to stay away from the drug. That's the stage of dependence.
So do we have any data on, like, what is the percentage, like if 100 people consume, let's say, cannabis, let's say charas or ganja, what is the percentage of people who develop some types of dependence on it?
Right. So in case of bhang, what we found was, if there are 100 people consuming bhang, just about 10 or 20 would display the features of dependence. But this percentage would be much higher in case of charas or ganja. About 30-35 people would using charas ganja would
among regular users.
Features. Yes.
And how is it different from other substances like non-alcohol substances?
in general, cannabis is supposed to be a less dependence, a drug with less dependence potential.
Okay.
As I was telling you before, the reasons why people become dependent on some psychoactive drugs is twofold. One is when they take drugs, they take these substances, they get immense amount of pleasure, immense amount of happiness, or some kind of relief, whatever relief they were seeking. Then there comes a stage when not taking that substance starts giving them very distressing withdrawal symptoms, sickness. So, which simply means a drug which will give you more sharper and higher kick will be more addictive. And a drug which, when not taken, will give rise to more steep fall, more serious and distressing withdrawal symptoms. That drug will be more addictive. Cannabis or charas ganja has neither of these properties. So the high is not very high, such as like for cocaine or heroin. And the withdrawal symptoms are practically non-existent and non-specific. So that's why dependence on cannabis is far rarer as compared to, say, heroin or cocaine and so on. That's the.
So what is the difference in the way heroin or cocaine affects the mind or the body compared to, let's say, something like cannabis?
So basically drugs are categorized or labeled in terms of their predominant effect on your mind. There are some substances which are predominantly brain depressants. Brain depressants means if you consume them, all the processes of your brain tend to be slowed down. Excessively, if you consume them, then you are likely to go to sleep or even lose your consciousness. Alcohol is a typical example. It slows you down, you feel drowsy, you start stuttering, you lose your balance, finally you fall down, you go to sleep or you fall unconscious. Same thing happens to a large extent with opioids, which means something like heroin. Then there are some substances which are stimulants, brain stimulants. On taking them, you lose your sleep. You feel a high, you feel a pleasure, but on top of it, you also lose your sleep. You feel a sense of rush or energy. Cocaine is the typical example of a stimulant drug.
And what is cocaine made of? Like
cocaine is made of coca leaves.
So just like not from opium.
Not from opium. So basically, these are three major plant-based drugs:
cannabis, opium, and coca leaves.
Opium and coca. Coca is the product largely of the South American countries. So and that's why it's very rare in India. So cocaine is a stimulant, very expensive in India, and also not used. The figures which we got from our survey are really in micro numbers. Point something kind of people. Very few Indians are using cocaine. It's only the rich upper class which probably is using, because they are probably the ones who can afford it.
It's expensive. And what is the statistic for like prevalence for opium based drugs?
Yes, opioids are the major cause of worry for India at this moment. Now we must understand that these opioid drugs basically means opium-like. The word opioid means like opium. So there is this opium plant, a very useful plant, because this opium actually is a source material for many of the medicines. And those medicines are very useful as painkillers. Some of them actually perform life-saving kind of purpose. So,
morphine, etc.
Absolutely. And hence, India has a very large and long tradition of legal cultivation of heroin. Which actually started getting patronized, encouraged, and in fact, many Indian farmers were exploited by, again, the British government.
Because of the opium trade.
They used to get opium cultivated in India and sold it illegally in a way to China. So we have had, and we still continue to have, in at least 3 states of India, UP, MP and Rajasthan, legal cultivation of opium for the purpose of making medicines. So that's one reason, and that because of this, we possibly have an established cultural pattern of use of opium also in some parts of the country, which is a part of culture. So that is there. But then the opium or some other byproducts of that plant, what are known as doda, or chura, or fukki,
Okay.
or poppy husk basically.
Poppy husk, right.
So those are the concentration of opioid alkaloids is very low in them, and hence they are supposed to be much milder, much less potent.
Okay.
Another drug which is made out of opium as a raw material is heroin.
Okay.
Which is much more potent, which acts very fast on your body and much more addictive.
Okay.
So it's very difficult for someone to actually use opium only occasionally, you know.
Right.
So once people start taking it regularly,
Right.
The downward slope to developing full-blown addiction is
Right.
very rapid in case of heroin. And that's why, and because of its being illegal and all, it's quite expensive also. It's profitable for someone to engage in heroin trade.
Right.
And that probably has happened with India.
Okay.
That from 1980s onwards, we actually saw a gradual shift of in the pattern of use of opioids in the country.
Okay.
When after late 80s, it's heroin which started making its entry in many, initially from the bigger cities and then from the smaller towns and even to the rural areas.
Okay.
And now heroin use disorders is really a major cause of worry in the entire North Indian belt.
Okay.
South and West
Right,
also,
right.
some states are affected, but
Right.
largely it's the North Indian belt. Why? Actually, when we saw our survey reports, we found very interesting pieces of data.
Okay.
If we look at if we arrange all the states of India in terms of percentage of people affected by heroin addiction, the top ranking 5 states are those in the Northeast.
Okay.
The next 5 states are in the Northwest bordering Pakistan.
Like Punjab,
So
Haryana.
which again, Punjab, Haryana, Delhi, Daman and Diu and Himachal Pradesh.
Okay.
And there on Northeast, we have Manipur, Nagaland, Arunachal, Mizoram, and
Bordering
Meghalaya,
Myanmar.
bordering Myanmar. So basically, Northeast and Northwest, which are known heroin trafficking routes,
Right.
states lying here have a highest prevalence of heroin use disorders.
Right.
So which actually tells us that maximum amount of our opioid problems is caused not so much by our homegrown cultivation of opium, but by this
Import.
illegally trafficked,
Right.
smuggled heroin which
heroin.
is coming from outside.
Okay.
So that's where the focus really should be. In fact, MP, UP and Rajasthan,
Which grow.
they have
opium.
which grow opium, they have one of the lowest ranks in
Okay.
terms of opioid use disorders.
Okay. So in northeastern and northwestern part, this is actively being pushed.
Being pushed
Right.
or being trafficked from here and there is a spillover effect,
Right.
one doesn't know.
Yeah.
For a long time it has been held that India's drug problem, particularly heroin problem, is more of a transit phenomena. Transit phenomena means India is a transit country.
Right. It just falls on the route.
It just falls on the route and we are not really the consumers.
Ah.
But then when we looked at the data on how much heroin is estimated to be consumed in India
Right.
versus how much heroin is being seized by our law enforcement agencies, that was another shock.
Okay. What did the data say?
Why? Because when we looked at the reports from the Narcotics Control Bureau, they have provided reports of heroin seized in India by all the agencies put together.
Okay.
So around by that piece of data, around 1800 kilograms of heroin is seized in India every year.
Okay.
If it is further diluted and sold in retail on the streets,
Right.
for the street level people who use drugs, that becomes about 18,000 kilogram heroin which they are seizing.
Just 10 times more.
No, but that's not what I'm saying. Even if we assume that they are seizing 18,000 kilograms of heroin every year, that sounds like a big figure.
Yeah.
But then if we assume all heroin dependent people in India are using just half a gram of heroin per day, which is really the minimum, 0.5 gram. We are using in India 360,000 kilograms of heroin every year. So which means just about 5% of heroin seized in India out of whatever heroin is consumed by people affected by heroin addiction in India. So that just tells
the problem
us
is really huge.
the scale of the problem,
Right.
and that also tells us that perhaps just by the sheer brute force, sheer enhancing your law enforcement apparatus and so on,
Yeah.
it's unlikely that you will be able to mount an effective response against drug problems.
Right.
In fact, no country in the world has been able to do
Absolutely.
it. The superpowers of the world,
Yes.
America, has not been able to address it.
It has had very tough laws for the last 30-40 years.
Lot of laws. They have
drugs.
waged a war on drugs.
And they have a lot of people who are in jail for minor
Yes.
crimes on drugs. But they've not
Yes.
been able to solve the consumption problem that
No,
so many
no,
people
no, they
continue
have
to
not. They have
consume
not.
it
They have
and
not.
depend on it.
Yes. So just
Right.
that's why just by supply control,
Yeah.
believing that somehow we will be able to cut the supply and availability of drugs
Yeah.
and create what they call a drug-free world.
Right.
It's not going to happen.
Yeah. So when we look at drug dependence or consumption per se from a public health point of view, so you, if I'm right, you're the director of the National.
I'm a professor at
You're
the
a
National
professor.
Drug
Okay,
Dependence
you're a professor at that center. So when you interact with people who are suffering from one or the other type of dependence, what is the, like, let's say there are 3 crore people consuming cannabis, there's 15 crores consuming alcohol, and there are some other statistic consuming opiates or opioid substances. What is the highest rate of dependence that you interact with at the center? Or
Yeah, so that's what I was telling you about. That meeting the criteria for dependence is one thing, but being affected by it to that serious level or extent that you need help,
Right.
you must go to a doctor and seek help. That brings another dimension of severity.
okay,
And in terms of help seeking or in terms of overall problems because of your drug
Yeah.
addiction, opioids are the number 1 category
okay,
anywhere in the world. If you look at the World Drug Report also,
yeah,
they'll tell you that even if globally more number of people are using cannabis,
right,
the problem drug users are maximum from the opioid group.
oh,
So and if we compare the global data with the Indian data,
right,
our statistics for consumption of cannabis, bhang, charas and ganja
Right.
are much less than the global average.
okay,
And we taught actually the world what cannabis is,
right.
but our
We don't really
consumption
consume
statistics I mean, we don't really consume it, or
Yeah.
we don't really tell about it. We
Yeah.
don't really know about it. That's
Yeah.
a different issue.
Mhm.
But our consumption statistics for opioids
Mhm.
are 3 times that of global average.
Okay,
Right. So that's the heroin epidemic I was talking to you about.
okay,
Globally, it's a 0.7% of the
Right.
general population, which
Right.
is the current user of opioids.
Mhm.
In India, it's 2.1%, exactly
Okay.
about 3 times.
yeah,
So, and that's all. And partly that is because some years back, 1980s, when I was talking about, we made both
Mhm.
charas ganja and heroin. We brought both of them in the same category,
yes,
right?
Mhm.
So when both of them were banned, both of them were illegal.
right,
When trafficking in both of them could put you in jail for 10 years,
Mhm.
but the profit
right,
margin, the difference was more than 30-40 times.
for opiates,
So there was an incentive for the market,
right,
illicit drug market, to shift from charas ganja to heroin.
right, right, right,
So most of our patient population, when we interact with them,
Mhm.
they tell us that we used to consume charas and ganja,
Hmm.
and then someone came and introduced us to heroin, telling that try this,
Right.
this is better stuff, you will get a better kick or high.
Right.
Initially, I was given it for free of cost.
Hmm.
I tried it for a few days, then I
Right,
got
right.
hooked onto it,
Right.
and then gradually the decline started
Right.
occurring.
This is a very interesting point that you've raised, because a lot of countries who have actually done something about addressing the dependence crisis or drug dependence crisis in the countries, a lot of them have adopted the approach of decriminalizing or, legalizing the use of cannabis. Some countries have gone as far as, decriminalizing all types of drugs. So when we study those approaches, do you think India has some lessons that we can learn, like in terms of how we approach drugs and laws about drugs, and not just, blanket banning all drugs?
So yes, absolutely right. So basically, the framework or the perspective that not all psychoactive substances are equal.
Right.
There is different degrees of harms, and hence there should be different stringency in
Right.
terms of regulating them.
Right.
That concept already exists in India. For instance, tea or coffee, they are also psychoactive substances,
Exactly.
not regulated at all.
Yeah.
Alcohol, psychoactive substance, but regulated to a large extent.
Right.
Even in the states where it is legal,
Right.
only licensed shops can sell, and many other laws and regulations. Some other substances totally banned or illegal. So time has come now, even among those substances which we say are totally banned or illegal, there has to be a graded kind of approach, calibrated approach,
Okay.
so that our supply control strategies, they are calibrated according to the level of harm those drugs or substances can cause.
Okay.
So that's something which we must, as a principle, we need to adopt this.
Right.
Then we can go into nitty-gritties of how to and to how much to control and to what level.
Okay.
What you are saying is absolutely right. That most countries of the world, they realized, for instance, the countries or the states in US,
Right.
where you are saying that they have legalized
Yeah.
marijuana.
Right.
What they found was that the trade continues to take place in
Yeah.
cannabis. We spend a lot of money in trying to control this trade,
Yeah.
in law enforcement,
Right,
our
right.
police, our criminal
Yes.
justice system, our jails.
Right.
All of us are wasting money and resources and time
Right.
in trying to catch this.
Right.
But this keeps still ongoing.
Right.
And on top of it, we are spending money, and all the profits are being controlled by the mafia. Right?
Yeah.
So in other words, the government actually thought कि हम तो बुद्धू बन रहे हैं, right?
Yeah. Tax भी नहीं दे रहा कोई उस पे.
टैक्स भी नहीं दे रहा है. So that's how they realized that there is no point in trying to continue playing this चूहा बिल्ली का game
Yeah.
with the drug traffickers. Let us regulate this.
Right.
We will allow this, but with strict regulations, because they also knew. It's not like that just because something becomes illegal, it will everyone will start consuming it.
Yeah.
Alcohol is a prime example for us.
Right. Right.
It's a legal substance.
Yeah.
People complain कि कितना आराम से मिलता है और खुल के मिल रहा है और सब कुछ, but still only 15% of Indians are consuming
Exactly.
alcohol.
Yeah.
Right?
So it's not like everyone's rushing
It's
to
not
consume
everyone is
alcohol.
rushing to. It's not. I mean, it's a. So that's what legalization entails. Then there is next level of reform,
Right.
slightly less liberal than legalization, which is decriminalization.
Right.
Decriminalization simply means the product remains illegal, product remains banned, trade and trafficking in that product remains banned. But if you are caught with a small amount for your own personal consumption,
Right.
you will not be treated as a criminal.
Right.
So user will not be treated as a criminal, a trafficker will be.
Okay.
The user will still be helped. User will be in an institutional framework. User will be sent to us for counseling,
Right.
for treatment,
Seeking help.
for
Yeah.
some other kind of center in a formal, systematic manner,
Right.
and will be helped to come out of that issue,
Right.
rather than burdening the criminal justice system with that
Right,
person. That's what decriminalization basically means. So at least, if not legalization, at least decriminalization is something India should seriously consider.
Okay. For all drugs or for some drugs?
At least for some drugs such as cannabis to begin with.
Okay. Right.
So that number one, we will reduce to a large extent the stigma associated with drug use.
Right.
We will reduce the burden on our law enforcement agencies, our police and narcotics control bureau of catching this
Right.
small time users.
Yes. Yes.
If you look at the National Crime Record Bureau data for last year, about 60% cases booked for NDPS are those of small quantity.
Okay.
Which means they are effectively people who use drugs are being caught and put in jail. The energy and efforts,
Yeah.
which can go definitely into catching the big traffickers. Now, I have no doubt about the expertise
Right.
of our drug law enforcement agencies. They are very fine agencies. They are actually known world over for
Right.
the fine work they have been doing and they are capable of doing. But if the system is such that they are spread thin all over,
Yeah.
if their all efforts are diluted in
Right,
catching
right.
even the little kind of drug issues,
Yeah.
then the concentrated manner in which they need to make a dent
Right.
in the overall drug scene,
Yeah.
that will not take place.
Okay.
And that's what I pointed out about heroin. So
Right.
even with all efforts, just 5% of heroin being
Yes.
trafficked in India
Yes.
is being.
Whereas that is the bigger problem than
That is the
cannabis.
far
Yes,
bigger
yes,
problem.
yes. Some countries have gone with the approach of actually legalizing all drugs, or at least decriminalize, like Portugal or Netherlands did it.
So what Portugal and many other countries similar
Right.
to that. Portugal is the prime example
Right.
because it's the first,
Yeah.
and it's very well documented and researched.
Okay.
But many other countries have tried those kind of approaches. So what they do is, whenever they find a person in possession of a small quantity of drugs,
Right.
and which is meant for his personal consumption only, that person is not sent to the police and criminal justice system.
Okay.
But person is sent to something which in their language is known as a dissuasion commission.
Okay.
So the idea is that commission, that group, where are social workers and
Right.
counselors and doctors, they will talk to this person, provide him the advice and counseling,
Right.
and try to discourage him from taking drugs.
Okay.
The very people, whenever this approach is started, people worry that, अरे यार, decriminalization, everyone will start using drugs.
Yeah.
लोगों में डर नहीं रहेगा कानून का, right?
Yeah.
What they found in Portugal was that their drug prevalence actually came down.
Because it was legal.
Because not legal,
Yeah.
because it was decriminalized.
Decriminalized.
It was still illegal.
Right. 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 But
If you are
individuals
caught,
were not
if
punished.
you are caught with kilos and tons
Yeah,
of stuff, you will still be put behind bars.
Right. Right.
But if one pudiya is found in your pocket,
Right.
you will be treated as a user. And because of this, what happened was there was an overall atmosphere in the society of that drug use is not a crime. If you have a problem, come forward and let's help you.
Right. Right. Right.
So that helped many young people to come forward, seek help,
yeah.
and go to a different trajectory altogether.
Right. Right.
And that's how gradually the prevalence and even incidence among young people of drug use started coming down. Today, Portugal has one of the lowest prevalences of drug use in entire Western Europe.
Wow.
So that's the kind
It
of
makes easy for people to come out, seek help for a problem.
Seek help for a problem.
Do you think? Do you see people seeking help voluntarily, especially young people in the country?
Yes, absolutely. If they know that the place where I am going to take help is going to treat me well, is not going to unnecessarily discriminate against
Right.
me, you know, they will have an empathic approach to me, and most importantly, they have the tools and the expertise,
Right.
whatever it takes
Right.
to help me, then they will certainly come. The crowded OPDs and the waiting list of our ward, they are testimony to this fact.
Right.
So people complain कि यार लोग तो नशा छोड़ना ही नहीं चाहते, लोग इलाज कराना ही नहीं चाहते.
Yeah.
That's not the case.
Right.
You make the effective, attractive treatment services, affordable treatment services available, people will flock.
Right.
There is serious gap of effective treatment services in the country. Just 1 in 38 people affected by alcohol dependence reports that I have received any kind of help in my life.
Okay.
That's the treatment gap.
1 in 30.
1 in 38.
38.
And
Wow.
if you ask them about whether you have been admitted to a hospital,
Right.
to a so-called de-addiction or a
Right.
rehab center, the ratio is 1 in 180.
Oh, it means like hardly anybody.
Hardly anybody. So, hardly anybody given the
Right.
magnitude of the problem.
Exactly.
So about 6 crore people need help for their alcohol problems.
Right.
And taking all the drug together, about
Right.
7 to 8 crore 8 crore people in the country need help for their drug use problems.
In
And
total.
the total
all
capacity of the country is not more than 4 lakh individuals per year.
Okay.
Right? So it will take us about 200 years to provide treatment to everyone by this rate.
On the current rate. Right.
On the current rate.
So
So there is a need of massive investment
Right.
in mental health resources in general,
Right.
and in for addiction treatment in general.
So going forward, like looking at all the examples of different countries, looking at how different drugs affect people differently, and classifying drugs depending on the rate of dependence that they have, or the public health or the health disadvantages one can have while consuming. what do you suggest could be a good strategy for India to go forward in terms of addressing this epidemic of dependence?
Funny that you talk of other countries and what we can learn from them.
Right.
Because whenever we take such examples, Portugal, Canada, other examples, so there is a common complaint of people is देखा है उस country का GDP, देखा है उस country का human development level. So the idea is that we cannot emulate someone because they are rich countries. They are different from us. But when it came to banning charas and ganja, no one thought कि हम तो गरीब देश हैं, हम तो हजारों सालों से ले रहे हैं, हम क्यों बैन करें?
Exactly.
Then whenever such systems have to be put in place, then we emulate every other country.
Right.
But whenever it comes to discussing what more we can do for our people, then always cost and resources, all those issues come up. So that again is a misconception. It's a misconception that you need massive amount of money in order to provide effective policies or systems whereby you can help people.
Right.
Whatever we have, we can use it efficiently in order to provide local systems, local ways of helping people.
Okay.
Creating the environment in which more and more people are encouraged to come forward and take help.
Right.
So one of the first steps should be a clear message that our law, our system, our society as a whole is not against people who use drugs. We don't see them as criminals.
Right.
They are simply people who need help, and if they come forward to take help, they are most welcome with open arms.
Right.
So as long as you are not shunning people away, you are not isolating them further, there is no reason why people won't come forward, and it will be then far easier and effective to help them.
Right.
So
we need to do away with the stigma.
Away with the stigma as a first measure. Right. And whatever legal and policy reforms are required for that purpose, that those will have to be thought about and those will have to be implemented. Finally, providing good and effective addiction treatment does not actually means getting admitted to a rehab center for 6 months.
Okay.
Right. So what we need to understand is drug use disorders or addiction, what we call it, are actually chronic non-communicable diseases, just like diabetes, blood pressure or hypertension, depression or so on. These are not the things which require a 3-month or 4-month hospitalization and then you will be all right throughout the life. Right. These are the things which are a part of your life.
Management, they require
manage.
Right.
So you make some lifestyle changes.
Yes.
You change your way of thinking. You take some medicines.
Right.
Which mean you to take perhaps many years or in some cases even lifelong altogether.
Right.
So fine, even if it helps you being healthy and productive, why not?
Right.
So that's the kind of approach by which we at AIIMS treat maximum of our patients.
Okay.
We do have a hospital, 50-bedded hospital, which is always full. Pre-COVID at least it was always full. So, but the maximum clientele of ours actually gets treatment in the outpatient settings. So there are many months to years people keep coming to us, take prescription, advice, take their medicines, and then they do very well throughout their lives.
Okay.
In between, there are always crises. In between, there will be lapses and relapses. It's a part of recovery process. Right?
Just like for diabetes, there will be a phase.
There may be a phase where blood sugar is not being controlled.
Right.
Some efforts, and then again you are back to being fine.
Right.
That happens with drug use as well.
Right.
So that kind of societal awareness is important.
We need to think of it as a very public health problem rather than anything
public
else.
Health problem and not something which is morally very wrong.
Right.
So that's why declaring that you have diabetes or hypertension is a badge of honor, you know.
It's an elite
telling
disease,
someone मेरी चाय में चीनी मत डालिएगा मुझे diabetes है, you know. So that becomes a kind of status symbol.
Sugar itself is very addictive, but it's sort of
it is. Yes, it is. Sugar itself is very addictive, and in fact, among all the public health measures now, increased taxation on sugary drinks is also one of the measures for public health.
Yes.
So that's what I was telling you about. The reducing the stigma in the society is absolutely important. Stigma for drug use disorders, and for that you need to remove that moral lens.
Yes.
Moral lens of people using drugs are somehow inferior human beings.
Right.
You know? That kind of moral lens need to be removed.
Right. Dr. Ambekar, thank you so much for coming. It was a pleasure talking to you.
Pleasure of mine.
Thank you.
Thank you.